Can a procedure designed to rejuvenate your most intimate tissues accidentally awaken an incurable dormant virus hiding in your spinal cord?
I mean, it sounds like complete science fiction,
Yeah.
but it is a very real, very precarious biological tightrope.
Yeah, because you go into a clinic for tissue rejuvenation and
Yeah.
you introduce a physical variable that could potentially, trigger a microscopic chain reaction leading straight back to your central nervous system.
Exactly. It's fascinating, but also a little terrifying if you don't know the science behind it.
Which brings us to the highly specific focus for today's deep dive. We're asking, can a regenerative intimate wellness procedure, specifically the O-shot injection, can it trigger a temporary viral flare in patients with a history of genital herpes simplex virus, or HSV2?
And, well, the short answer is yes. I mean, it is biologically possible,
Right.
but the mechanism behind how it happens, and more importantly, how modern medicine successfully prevents it, is just this absolute masterclass in human immunology and virology.
It really is. And to figure out exactly how the medical community navigates this, we have a really fascinating stack of sources to unpack for you today.
We really do. We're looking at the aesthetic complication guidelines from BAMAN, which is the Aesthetic Complications Expert Group.
Right, and we're also pulling from clinical FAQ documents and protocols from Dr. B's clinic down in Naples, Florida, alongside some cutting-edge research on platelet-rich plasma.
Plus, we've got several deep-in-the-weeds medical case studies detailing herpes simplex virus latency and, some really wild alternative therapies.
Yeah, it is a remarkable cross-section of information. We are basically bridging everyday clinical safety protocols with super high-level neurological research. So our mission today is to uncover the hidden relationship between medical needles, our nerve endings, and latent viruses.
It's a journey, for sure.
Okay, let's unpack this. To understand how a wellness injection could possibly cause a viral flare, we need to talk about where the virus actually goes when you don't have an active outbreak, because we know HSV2 doesn't just leave the body.
It does not. No, the virus is a total master of evasion.
Yeah.
Yeah. When your immune system clears the visible surface outbreak, the virus just retreats. It travels retrograde, which means backward up the local sensory nerve fibers.
Wow, okay. Backward up the nerve.
Exactly. It goes all the way until it reaches a structure called the dorsal root nerve ganglion.
And what exactly is that?
It's essentially a cluster of nerve cell bodies situated right outside the spinal cord.
Okay, and once it gets into that ganglion, it goes into a state of latency, right?
Latency,
Oh.
which is this fascinating survival mechanism. The viral DNA basically circularizes into something called an episome inside the nucleus of your nerve cell.
So it's physically altering its shape.
Pretty much.
Yeah.
And it stops producing the proteins that would normally, alert your immune system to an infection.
Ah, so it goes stealth mode.
Total stealth mode. Instead, it only produces something called latency-associated transcript, or LAT, which basically prevents the nerve cell from destroying itself.
What's fascinating here is how the virus uses our own nervous system's architecture as a hiding spot. It just sits there in the dark, completely shielded from your immune system's radar.
It is basically a bear hibernating in a biological cave.
That is a great way to look at it.
Right. I mean, the nerve ganglion is that deep, dark cave, and while the bear is asleep, you have absolutely no idea it's even there.
Exactly.
But obviously, if something disturbs the cave, the bear wakes up angry and charges right back out the exact same path it took to get in.
Right, and the virus is essentially waiting for the host's defenses to drop, or for a very specific distress signal to travel up that nerve, indicating that the local tissue environment has changed.
And what triggers that distress signal?
Well, it can be triggered by a lot of things: systemic stress, extreme temperature changes, immunosuppression, or, and this is key for us, local physical trauma. Okay, so if the virus is safely locked away in a spinal nerve ganglion, the only way it becomes a problem during a pelvic procedure is if the physical trauma of the injection travels up that same nerve pathway.
Bingo. You are introducing a medical needle into the exact territory where those sensory nerve endings live.
Wow. And the BAMAN complication guidelines actually map this out really clearly. They state that reactivation can be provoked if a needle directly damages a nerve axon during the procedure.
Yeah, direct damage is definitely a trigger.
But I mean, the needle doesn't actually have to hit the nerve dead on to cause a problem, does it? The tissue manipulation alone has to cause some level of disruption.
Oh, absolutely. Even if the needle misses the nerve entirely, just the simple act of penetrating the tissue causes microtrauma.
Right.
Your body immediately responds to that by releasing inflammatory mediators. Things like prostaglandins, histamines, and cytokines.
Okay, the body's alarm bells.
Exactly. And these chemicals bind to the receptors on the local nerve endings. That binding action sends a rapid, retrograde chemical distress signal all the way back up to the dorsal root ganglion.
And when that biochemical alarm bell rings in the ganglion, it acts as a transcription factor, right? Turning off the viral latency and turning the replication genes back on.
Yep. The bear wakes up.
Yeah.
The inflammation actively changes the cellular environment, providing the catalyst that just breaks the viral latency.
Okay, wait. If just the localized inflammation from a tiny needle prick can set off this cascade, we really need to talk about scale here.
Okay, let's talk scale.
Because millions of people get cosmetic and wellness injections every single year. And the BAMN guidelines mention a 1.45% incidence rate for HSV reactivation after standard dermal filler injections.
Yeah, 1.45%.
Which might sound low on paper, but I mean, in the aesthetic industry, that represents tens of thousands of patients. If just a tiny needle prick can cause an outbreak, why aren't we seeing massive viral flares across the entire cosmetic injection industry?
It's a fair question, and it is a significant clinical concern. But to understand the mechanism of the trigger, we really should compare that 1.45% needle complication rate to a procedure that causes a much, much different type of trauma,
Okay, like what?
like carbon dioxide laser skin resurfacing.
Oh, wow.
Yeah, with CO2 lasers, the post-procedure viral infection rate jumps to 7.4%.
Seriously, 7.4%.
Yep.
So an ablative laser, which is essentially causing a controlled burn over a large surface area, is vastly more likely to wake the virus than a single precise needle stick.
Exactly. Because the volume and the type of trauma dictate the volume of the cytokine release.
That makes sense.
Right. A single needle stick creates a very localized, minimal inflammatory whisper. But an ablative laser, which vaporizes the top layers of tissue across a wide area, creates a massive roaring alarm of cytokines.
Oh, wow, yeah, that's a huge difference.
The nerve endings are just overwhelmed by the chemical distress signals, making viral reactivation highly probable if the patient has a history of latency in those specific dermatomes.
Okay, so if a patient knows they have this dormant virus and they know the physical trauma of an O-shot could send that whisper of inflammation up the nerve, how does anyone safely get this procedure? I mean, clinics can't just cross their fingers and hope you fall outside that 1.45%, right?
No, they absolutely do not leave it to chance. The clinical reality relies on very aggressive preemptive protocols.
Like what we see in the sources from Dr. B's clinic.
Exactly. If you look at the instructions from Dr. B's clinic in Naples, their contraindications are incredibly strict. Patients must cancel their appointment if they have an active outbreak of genital herpes, active vaginal infections, or any untreated pelvic conditions.
Which makes total biological sense. If the virus is already actively replicating and causing an inflammatory lesion, throwing a needle into that environment will just like pour gasoline on the fire.
Oh, 100%. You'd exacerbate the inflammatory cascade exponentially.
But for a patient whose virus is safely dormant, the protocol dictates they must disclose their HSV-2 history to the physician beforehand, right?
Yes, disclosure is vital. Because once the doctor knows, they initiate a prophylactic shield. They prescribe a course of systemic antiviral medication to be taken before the needle ever touches the skin.
Okay, let's look at the mechanism of that shield, because the data from the facial laser resurfacing study in our sources is just staggering.
It really is.
They took 120 patients undergoing laser resurfacing, which we just established has that really high 7.4% trigger rate, and they gave them a regimen of valciclovir.
The dose was 500 milligrams twice a day for 10 to 14 days, starting the day prior to the procedure.
And the results. Out of those 120 high-risk laser patients, there were 0 viral recurrences.
0. The prophylactic regimen completely neutralized the threat.
0 outbreaks from a laser burn. So how is the valciclovir actually stopping the virus? If the laser or the needle still sends that inflammatory distress signal to the nerve and the virus technically wakes up, how does the drug put a stop to it?
Right, so antiviral prophylaxis works by inhibiting the viral DNA polymerase.
Okay, break that down for me.
Sure. When the virus wakes up in the ganglion, its first task is to multiply. And to do that, it needs to copy its own DNA using an enzyme called DNA polymerase.
Makes sense.
Well, valciclovir is a prodrug that eventually converts into a faulty building block inside the body. So when the virus tries to use that block to build a new strand of DNA, the structure just fails. The chain terminates.
Wow. It's essentially jamming the biological copy machine.
That's a perfect analogy, yeah.
The virus is awake, it has the blueprint to replicate, but every time it tries to print a copy, the machine breaks down.
Exactly. It can't multiply, so it can't travel back down the nerve to cause an outbreak on the skin.
So what does this all mean? It means total transparency with your doctor is absolutely non-negotiable. If they know your history, they can easily jam the copy machine before things get out of hand.
Yes. By establishing that chemical roadblock before the procedure begins, the physician ensures that even if the physical trauma triggers a reactivation attempt, the virus is chemically paralyzed.
But here's where it gets really interesting. We've established the needle is a potential trigger, and antivirals are the shield. But the actual substance being injected during an O-shot is platelet-rich plasma.
Yes. And this is where the conversation completely flips from risk management to unexpected therapeutic benefits.
Because platelet-rich plasma, or PRP, involves drawing the patient's own blood, right?
Yep. They spin it in a centrifuge to isolate the platelets and growth factors, and then they inject that concentrated serum back into the target tissue.
Which is incredibly safe, according to the sources.
Oh, exceptionally safe.
Yeah.
I mean, the text compares PRP's safety to aspirin. Aspirin causes like 3,000 bleeding deaths a year, whereas PRP is derived from the patient's own body.
That's wild. But from a layman's perspective, injecting a highly concentrated cocktail of growth-stimulating fluid into tissue where a virus actively likes to attack, it sounds like you're just feeding the area.
You would think so, but the sources highlight a massive twist.
Yeah, this blew my mind. Women with a history of recurrent vaginal herpes who get the O-shot actually see the frequency and severity of their viral recurrences decrease significantly after the procedure.
It is a striking clinical paradox. I mean, the procedure that theoretically introduces the physical risk of waking the virus ends up biologically suppressing it long-term.
How is that even possible? If the PRP isn't just acting as blind fertilizer for whatever's in the tissue, what exactly is it doing at a cellular level to beat back an incurable virus?
Well, it fundamentally alters the local immune landscape.
Okay.
See, the alpha granules inside those concentrated platelets are packed with specific growth factors, things like platelet-derived growth factor, transforming growth factor beta, and vascular endothelial growth factor.
That is a lot of factors.
It is. But when they get activated in the tissue, these factors do not simply promote mindless cell division.
They don't just patch a hole in the wall.
No. They release chemotactic factors that act as a highly sophisticated signaling system.
Oh, interesting.
Yeah, they draw in macrophages, which are those specialized white blood cells that clean up cellular debris and target pathogens. They modulate the local T-cell responses. The source material actually describes an intelligence to this response.
So instead of just throwing down fertilizer, the PRP acts more like a localized software update for the immune system.
I love that. Yes.
It teaches the local tissue how to recognize and delete corrupted files, prioritizing normal tissue remodeling while becoming actively hostile to abnormal pathogens.
That is an excellent way to conceptualize it. If we connect this to the bigger picture, the growth factors recruit the body's elite defense mechanisms to heavily police that specific anatomical area. And this concept is vividly illustrated in the sources through a comparison to acromegaly.
Right. Acromegaly, that's the condition where a person's pituitary gland produces abnormally high levels of growth hormone throughout their entire life.
Yes. And you would naturally assume that a lifetime of excess growth hormone would cause cellular division to just run rampant, right? Leading to massive rates of cancer.
Yeah, that seems like the logical conclusion.
But the epidemiological data reveals the exact opposite. Individuals with acromegaly actually experience 25% less cancer than the general population.
That is so counterintuitive.
It really is. But the elevated growth factors maintain an incredibly strict biological vigilance. They promote healthy, highly regulated cellular environments and actively suppress dysplastic or abnormal growth.
Wow. So by injecting concentrated PRP into the vaginal tissue during an O-shot, you are temporarily recreating that hypervigilant environment.
Exactly.
You are upgrading the local immune software so thoroughly that even if the HSV-2 virus tries to travel down the nerve months later, the tissue shuts it down before a painful lesion can ever even form.
The clinical outcome is that patients who seek out the procedure for intimate wellness end up receiving a profound immunological fortification against a chronic viral condition.
That is amazing.
Yeah.
But what happens when we zoom out from a standard O-shot and look at cases where the viral infection is profoundly entrenched?
Yeah. This is where things get futuristic.
Because if we know we can alter the local tissue with PRP, What happens when standard antiviral shields like valciclover completely fail to jam the copy machine?
Well, the sources take us into the realm of advanced nerve healing, specifically focusing on severe drug-resistant viral flares. We have an extraordinary case study detailing a 68-year-old woman suffering from sacral herpes zoster.
Okay, so this is a related herpes virus, but it was violently attacking the sacral nerves at the base of her spine. And
Yeah.
she wasn't just dealing with surface skin lesions, right? The inflammation had triggered a condition called a neurogenic
It
bladder.
was awful. The viral inflammation in her sacral nerve root was so severe that it disrupted the parasympathetic signals controlling her bladder.
Oh,
She
no.
was in complete urinary retention, unable to void spontaneously, alongside experiencing just agonizing perineal pain.
And every traditional medical intervention completely failed.
Everything.
They flooded her system with antivirals to stop the replication. They administered systemic corticosteroids to bring down the massive inflammation. They used multimodal analgesics for the pain. They even performed a caudal epidural block, literally injecting steroids directly into the spinal space. And the virus just ignored all of it.
Yeah, the biochemical approach was completely exhausted. Nothing worked.
So what did they do?
The clinical team pivoted to a biophysical intervention. They utilized a technique called pulsed radiofrequency, or PRF, and applied it directly to her pudendal nerve.
Wait, if the valciclover was supposed to be the antivirus software deleting the malware and it failed because the malware had completely corrupted the system,
Yeah.
pulse radiofrequency sounds like performing a hard physical reset on the hardware itself.
That is exactly the mechanism. PRF delivers short, high-voltage electric pulses separated by long, silent phases.
Why the silent phases?
It allows the heat to dissipate, making it completely non-destructive to the nerve tissue. You're not burning anything. The therapeutic effect comes from the high-intensity electrical field itself.
But how does an electric field fix a nerve infected by a virus?
It alters the gene expression within the nerve. The electrical field physically suppresses the erratic nerve discharges. It downregulates microglial activation in the spinal cord, which halts the neuroinflammatory cascade, and it effectively resets the resting membrane potential of the neuron.
It forces the hardware to reboot and stop sending pain and dysfunction signals.
Yes, exactly.
And the timeline for her recovery in the case study is just unbelievable. I mean, after months of failed drug treatments and severe suffering, the PRF produced rapid and sustained pain relief. And she recovered her spontaneous bladder function within just 4 days.
4 days. 4 days to reverse a catastrophic neurogenic failure simply by changing the electrical environment of the nerve.
That is wild.
It really is. And radiofrequency isn't the only biophysical tool showing promise. The sources also detail the use of photobiomodulation.
Which involves lasers. But wait, we just established earlier that carbon dioxide lasers create massive thermal trauma and trigger 7.4% of latent viruses to wake up.
Right, but the distinction here lies in the wavelengths in the mechanism. A CO2 laser is ablative. It violently boils the water in the tissue to vaporize it, causing the massive cytokine release we discussed.
Okay, so a ton of trauma.
Exactly. The laser used in these clinical cases is a 635 nanometer low-level diode laser. It operates at an energy level that does not produce heat or tissue damage.
If it's not cutting or burning, how is it clearing up recurrent herpes lesions?
Photobiomodulation works at the mitochondrial level.
Right.
The 635 nanometer light penetrates the cell and is actually absorbed by an enzyme in the mitochondria called cytochrome C oxidase.
Okay.
This interaction dramatically boosts the production of ATP cellular energy and creates a very specific transient burst of reactive oxygen species.
So it's feeding the cell energy while simultaneously shifting the chemical balance inside the cell.
Precisely. This shift accelerates fibroblast proliferation,
Yeah.
rapidly rebuilding the connective tissue to heal the physical lesion.
Oh, wow.
But more importantly, the altered intracellular environment directly inhibits HSV replication.
Oh,
Yeah, the virus cannot effectively assemble itself in that modulated state. It clears the symptom rapidly, and critically, there is zero risk of the virus mutating to develop resistance to light energy, which is, a growing problem with chronic antiviral drug use.
this raises a massive question about the entire future of virology. For decades, the standard protocol has been purely biochemical, right? Flood the body with drugs to hunt down and suppress the virus.
Right. This raises an important question, though.
Exactly. Because the success of pulse radiofrequency, photobiomodulation, and even the localized immune updates from PRP suggest that we might have been fighting the battle on the wrong front.
Absolutely. Instead of solely focusing on attacking the viral pathogen, We are realizing the immense power of altering the environment where the virus lives.
Right.
By using electrical fields, light energy, and concentrated autologous growth factors, we can fortify the nervous system and the local tissue, basically stripping the virus of its ability to weaponize our biology.
If you are an O-shot patient or just someone fascinated by immunology, the takeaway here is incredibly empowering. Yes, an injection needle creates physical microtrauma that can theoretically send a distress signal to a dormant HSV-2 virus.
It can happen.
But clinical science is vastly outpacing the virus. Antiviral prophylaxis effortlessly jams the viral copy machine, and the platelet-rich plasma delivers a sophisticated software update to your immune system, often leaving the local tissue far more resilient against future outbreaks than it was before the procedure.
It illustrates why the intersection of regenerative medicine and virology is moving so fast. We're evolving from just managing symptoms to actively engineering biological resilience.
It makes you wonder what the next decade of research will unlock. I mean, if biophysical therapies can instantly reboot a failing nerve and growth factors can train local tissue to reject a chronic pathogen, are we approaching a future where we don't just force incurable viruses into temporary latency? Are we discovering the biological tools to permanently lock the ganglion, trapping the virus in the dark so it can never, ever wake up again? Think about that next time you look at a simple medical needle. Thanks for diving deep with us today.